a flat back, a neutral spine position. So the way we can find that is by having the individual move their pelvis. I almost call your pelvis like your bucket of water. We can move your bucket of water forward, like we're tipping the water. We can also tilt it back, like we're trying to keep that water. So the way we'll kind of instruct this is, we're gonna have the individual, you're gonna kind of place your hands around their pelvis, their bucket of water, right? And we're gonna have the individual move their bucket of water forward, so you can kind of manually kind of move them forward. It's almost like they're arching their back, right? So there's air there. That probably doesn't look like a good position to start out with, right? We said that position will kind of determine the outcome of what you're trying to do, right? So that's probably not a good position, but we're trying to find neutral. So that's your excessive forward position, like you're arching, and then we're gonna bring your belly button towards your nose, like you're tucking your tailbone underneath you. So that's a pretty flat position where everything is sealed, right? There's no air getting through. So I'm gonna have Melissa go forward and back 5 more times. Forward and back, and we're just gonna exaggerate that tilt forward and back. And after a couple reps, you're gonna have your individual, I want you to find the in-between point. Okay, what feels in the middle of that excessive forward and that excessive back? It's not a trick question, because that's how we find your neutral spot, your neutral flat back. So you tell me if that feels your neutral. So it's in between your forward and back. Okay, so now that position, right, she's not arching her back, so that's pretty good. And it looks like she sealed the ground. So that's the position we want to be in. That's like a neutral flat back. So if you're doing a glute bridge, anything that's on your back, people are always like, find your neutral spine. You're probably like, okay, what does that mean? Well, that's it. That's how you find a neutral spine. Okay, so from this position, now that we have our flat back, that's part 1. Now we're gonna work on just the breathing. So a good way that you can work on breathing is having one hand on your belly, one hand on your chest. Again, there's different schools of thoughts, like how many seconds did you breathe in your stomach, going towards your chest, but I almost think of just having like a 2-to-1 ratio, where you wanna think about, a lot of people who breathe, they expand from their upper chest. Sometimes that correlates to having a lot of stress in their neck, like upper neck pain, things like that, shoulder pain, because all this breathing is happening up here, and it's not breathing from your diaphragm, which is your main breather. So what we're gonna do here, Melissa, is you're gonna think about lifting your hand first. So you're gonna inhale through your nose, and you're gonna push your hand away from your belly, and then you're gonna send that air towards your chest, and then you can exhale like you're blowing out a candle purely. And what you're watching for is, you're just trying to see if their hand at the belly expands first, prior to their upper chest rising, and then you can just have them blow it out like a candle. Okay? Melissa's actually doing a really good job moving her bottom before the top hand moves, and I'm sure you guys can kind of see that. Maybe it's a little harder from the individuals over there, but that's essentially what the 2-to-1 ratio we want to capture is, starting from your diaphragm, sending it towards your chest, and then slowly blow it out like a candle. Okay, so once you kind of have your individual practice that a few times, that's the breathing. Okay, so right now Melissa's not really bracing. We're just going over what it's like to breathe. Okay, so let's say we want to get into position. Let's say now we want to progress that into, okay, well, how do I breathe and brace? Right, that's kind of the toughest part that we're going to do today, is how to coordinate breathing and bracing. But again, it's going to take some practice and things like that. So just the awareness and the coordination. So let's say I'm going to grab a object really quickly. We'll have Melissa. I'm going to challenge her a little bit. Have her get 10 pounds. So what we'll do right here first, before we have her move an object away from her body. So we worked on the breathing component, right? Just having her lift her stomach, 2-to-1 ratio before her chest rises. Now we're going to work on finding the brace as we breathe. So now, Melissa, I want you to fully exhale. Now, I want you to inhale.
The same way?
Yep, so you're gonna inhale. Find your level 5. So expand out. Now breathe out. And keep that level 5 as you breathe out. Now inhale. As you keep that level 5 around your lateral wall. Exhale. It's kind of tough to coordinate that. If you're having trouble keeping the brace as you breathe, one really good way to kind of capture that is, as you inhale, Melissa, I want you to slowly open up your mouth, and I want you to blow out like you're blowing out fog. So I want you to exaggerate that. all the way, all the way, all the way, all the way, more. You see, you feel that those lateral ribs right here? So that's another way you can have somebody find their lateral wall as they're breathing. Imagine they're blowing out hot air. Let's do that one more time. So let's inhale. Open your mouth slightly. I want you to pretend like you're blowing out fog and excessively exaggerate that. And you feel that lateral wall right here? So now we'll keep that tension. So keep that tension, right? That level 5 tension as we're breathing now. And that's the coordination. That's the tough part right here, is having to control that. Okay? So now that we're trying to put those pieces together on breathing and bracing, we're gonna hold this object above head. So this is the fun part. So now what I want you to do, Melissa, I want you to find that level 5, right? And as you slowly bring this back, you're going to inhale, keeping that nice little tension here. Bring this over your head. Control that, control that. Good. Exhale, bring it back up towards your starting position, finding that nice lateral wall at the same time. So now we're working on dynamically controlling her core, her breathing, but without worrying about her low back arching and things like that. So that's how we're trying to keep a good posture as we're moving dynamically, right? So let's do 5 of those reps. So let's have that nice little level 5 here. Let's inhale, let's go back. So you'll inhale as you raise your arms overhead, and you're only going as far back before you feel your low back is arching. Exhale, fill up that lateral wall. You should be feeling those obliques pretty good, and we've only done 2 reps. We got 3 more, so let's inhale. Good, the slower the better. Pause, exhale, compress those lateral ribs down towards your pocket. Good, we got 2 more, let's inhale. She's doing a really good job keeping this frame. Good, exhale. This is a good technique that we give to a lot of our individuals who have like low back pain and things like this. Again, we're trying to control what's happening at the spine as other things are moving. We'll go 1 more, let's inhale, expand. Good. And exhale, bring your ribs down. How'd that feel?
Good. It's a lot of mental work.
A lot of mental work, right? So that's the beauty of it is, again, we want to make sure breathing and bracing is an unconscious effort, but today we're going to just bring more awareness to that today. So we did 5 reps, and you probably felt your lateral wall, your obliques turn on pretty good, right? Yeah. And that's with her feet supported. Imagine if we were doing that feet hanging, right? Things like that, or one leg was extended, she was doing that. Those are ways to just progress the intensity of that movement and how to strengthen your core and things like that. So what we'll do